We're going.
Have you ever been injured and given a prescription for pain pills? Anyone?
Mm-hmm.
Yes. Did you ever consider taking more than what was recommended?
No.
Did you ever get that feeling of euphoria that you never wanted it to end? You can be honest.
Yep. They just make me sleepy.
Perhaps it took away the pain or the life experiences you wanted to forget and gave you a sense of peace for once. At some part in everyone's life, there was likely a prescription written for a narcotic painkiller, whether it was due to surgery, a car accident, or even a sports injury. For too long, we have actually allowed the pharmaceutical companies to continue to tell us what is best for us to take in these instances. As a matter of fact, pharmaceutical companies began selling their prescription narcotic painkillers, such as opioids, to the doctors and told them that there were no addictive qualities of these painkillers. Said that it was safe to take them, and even began paying doctors what they would refer to as kickbacks for the quantity and the amount that they wrote them. So just to go over a little bit of the opioids and what they can be is they range from codeine, oxycodone, morphine, and Dilaudid. But there's even illegal substances that are considered opioids, such as heroin and synthetic fentanyl. Synthetic fentanyl has been in the papers quite often recently. It's actually a very highly potent drug. Police officers are actually not allowed to field drug tests anymore because one tiny fleck on their skin can actually cause them to overdose. That's how potent it is. So it's actually very dangerous. So today when we talk about opioids, we're mainly talking about the prescriptions, but we're also talking about the illegal drugs because that plays a part in our epidemic that we're currently facing. Some say that opioids would change the world for the better by helping eliminate a patient's pain. And in a lot of instances that does happen. It gives them a new quality of life. It allows them to do things that they weren't able to do, such as if they had back pain, they're able to stand up, they're able to go on walks, do things. However, the continuous use of them, your body begins to build up a tolerance and then you require more to be able to get past that pain. Some who take them only for a temporary time actually become very addicted to it, that they can no longer live without it. Their body goes with withdrawals. They're not able to function on a day-to-day without it. So touching back on the doctors, they began receiving the kickbacks based on the frequency and quantity that they wrote based on Mark Zeza and Marcus Bachhuber. They were receiving these paybacks. They have thankfully since been discontinued and it's no longer allowed because the FDA stepped in and stated that that's not okay, that's wrong. That's selling your drugs to people. Even government officials blame the opioid epidemic on healthcare, such as Medicaid. They stated with Medicaid, it allowed easier access for people to get to their to the opioid prescriptions. So that's just in my opinion. I don't feel that that's accurate. I feel that regardless of what healthcare you're on, you have access to it. You have doctors who aren't willing to do the proper protocol to make sure that you're not abusing it. Now that we've covered the pharmaceutical industries and the doctor's involvement, let's move to how this continues to grow even after laws have been passed. As of September 1st, a new law went into effect, and it states that the patients may not be prescribed more than 10 days worth of opioids. So that does help us tremendously. Whereas sometimes you would be given 30 days of supply and would really only need it for 3 days, but then you'd be left with a plethora of pills that you're not just going to throw away because you paid for them. Also, opioid pills still available on the street. You can find someone who has them and purchase them from them. It's not a legal way to do it, but it happens. And then once again, an addict's body will build a tolerance to the pills, but they're more likely to start using drugs such as heroin and fentanyl. So once the pills no longer do anything for them, they will then begin to chase that high and go for the heavier stuff, such as heroin and fentanyl. Now that we've covered that, let's discuss some other options that can help us overcome this problem. Now, although opioids can help bring relief, their long-term effects outweigh the benefit. Stricter laws need to be put in place. Limiting the amount of days that you can prescribe someone isn't going to stop it there. There was a September 1st bill that we just spoke about. Well, there is a new bill that has been delayed until March of 2020 currently that will require doctors to have to go in and check a database to make sure that their patient hasn't received another prescription from another doctor recently. And that will actually be very effective. In the past, you were able to doctor shop, and that meant you could go from doctor to doctor to doctor and get the same prescription and have several prescriptions without anyone knowing. Even your health insurance wouldn't necessarily know until it was too late. In additional is finding additional pain therapies, such as CBD oil. A lot of states have actually legalized that now. And the reason for it is because there's great benefits for anxiety and for mental health disorders, but also pain. Several cancer patients will boast about having been on CBD oil and it helping them make it through. So we really need to test out those theories and make sure that, we can utilize something that is less addictive and less damaging to our bodies.